trying to catch up from yesterday to what I want to talk about today is that while the problem of cancer was due to a particular parasite, Phaseolopsis busci larval stages, the problem of lack of wellness seems to be, at this point, due to the second biggest parasite that we have, also a fluke, called fasciola. So if you're just plain ill with aches and pains that we associate with aging, and maybe it is the cause of aging. I'm theorizing that it is the cause of aging, because it's already known that radiation causes premature aging. And fasciola has been considered the most common parasite in the animal world for the U.S. This was in a dairy magazine that I get. So fasciola, although it's very, very quiet in your body, invades everything in time. And your muscles, your tendons, your cartilage, your eyes, your bone, everything. But it doesn't give you any indication of its existence. Although at every point where you have pain, you will find an adult. Every place you find a little brown round circle on your skin, you'll find an adult. Every place where you have bleeding also, you will find an adult. So we're just loaded. They can't be found if they're not in your intestinal tract. You can find the eggs in the urine easily enough, but you'd have to filter it, of course, to get them concentrated enough to see. And our patients bring in plenty of them. But in clinical science, it is thought that they exist in the intestine, and therefore the only place you would look would be in the bowel contents. But of course, that's the hardest place to look, the most miserable place to look, and that's not where they are. So that will take its time before maybe younger researchers of an intellectual bent manage to find them, because they will be looking. And that's the difference between finding and not finding, whether you look. Now, how could a parasite be the cause of your aches and pains and general ill health, whether it's your lungs or your pancreas or liver or spleen or muscular fatigue, a very common thing? And I think it's partly due to the fact that all of these ills we have are the result of lowered immunity that we have been getting in the past 100 years, and especially the last 50. Our immunity is severely lowered. Nobody is pursuing that, as far as I know. I spotted it about 20 years ago, and I immediately compared white blood cell counts. That's the first most obvious thing to do. If you're making less white blood cells, you've got an immune problem. And I did a series of about 250 or so white blood tests that gave me the white blood cell count and the breakdown of them into different categories and the age and what that person had come with. And I could see a statistically significant difference from a 10-year prior count. Okay, so I had two sets of counts about, I think, 10 years apart, and just did the averages and so on, and it was obvious. But I didn't know why. And it should have been perfectly obvious, since medical doctors always do a blood test that includes a white cell count. But you know what they did? What they did, it's really what the labs did. They changed the range. So now it would be the normal range to include those lower counts. Well, that's not fair. Not if you're interested in the phenomenon. I, to this day, don't know, how that gets decided. I hope it's a pure accident. But it always has baffled me. And when I came across this new radiation work that I was doing, I could see that our immunity could be linked to radiation in a new way that we had never thought of before. Now, you know that I have been looking inside our organs with this device. And I can look inside the white blood cells. It's easy enough. You just put a sample of white blood cells on one of the plates and search for something there. And if they're empty, while all around are bacteria or toxic substances, I must ask, why are they empty? Why aren't they at work? And then if I use something, maybe to stimulate them, I'll see them at work. They're full of those bacteria now, or something toxic nearby. And so I had a way of figuring out whether immunity was working or not. And I found that whenever there was radiation in them, they stopped working. Well, I thought that's terribly tragic, because our radiation level isn't something that we can change voluntarily. It's coming to us in all the water. 99% of the water that we drink, that comes to our homes, each one of us in the U.S., has radiation in it because it is chlorinated. 99% of the water in the U.S. is chlorinated. And chlorination by itself isn't the culprit. It's something that gets added to the water that is bringing the radiation. It's the chlorine disinfectant solution. So the chlorine disinfectant is, first of all, a gas which doesn't have the radiation, but then later on, when it gets close to your house, they have to monitor it to make sure that the chlorine level is high enough. There's a range, a legally required range for that. And if it isn't high enough, and invariably a little boosting is needed, then that particular station, the water department's little station, has to add sodium hypochlorite, which is bleach, in order to raise the chlorine level. And that bleach is of two kinds. The legally required bleach is food grade, of course. It's going into your drinking water. And there are requirements to be met, legal requirements, and there has to be a quality called National Standards Foundation, NSF quality. But up until about 4 years ago, over half actually of the water coming into the house from the city, direct from the city, was using the wrong bleach. They were running to the grocery store to get laundry bleach and just dump it in.